Sarah woke up one morning with a sharp, shooting pain traveling down her right leg, accompanied by a heavy numbness and a pins and needles sensation. She was experiencing lumbar radiculopathy triggered by a disc bulge in her lower spine pressing against her nerve roots. Every step she took felt excruciating, and the pain spread well below her knee. Simple daily activities like bending over or sitting at her desk became agonizing, and she began to worry that her active lifestyle was over for good. At its core, lumbar radicular pain is caused by the inflammation or compression of a spinal nerve. A very common cause of this radiculopathy is a disc herniation. Think of your spinal nerves like electrical wiring carrying signals from your lower back down to your legs. When a disc herniation presses against that wire, it sends erratic, painful signals traveling down the pathway. How is this condition typically identified? Clinicians often use a physical assessment called the slump test. So, what does lumbar radicular pain actually feel like? Symptoms vary from person to person, but commonly include sharp, shooting or burning pain that typically spreads below the knee, pins and needles and numbness, and muscle weakness in the affected leg. Importantly, you might feel severe leg pain even if your back doesn't hurt at all. Where you feel that pain depends entirely on which nerve root level is irritated. The L3 and L4 levels often project symptoms toward the front of the thigh and knee. Meanwhile, L5 and S1 radiculopathy follow distinct patterns. The L5 level frequently sends pain down the outer leg and into the top of the foot, while S1 tends to channel pain from the buttock down the back of the leg into the sole of the foot. Now for the good news, what can you actually do about it? For disc-related radiculopathy,
We look for your directional preference, the specific movement direction that makes your nerve happy. For disc-related radiculopathy, we use extension-based exercises because bending backward frequently centralizes symptoms, moving the pain out of your leg and back towards your spine.
Phase 1. Prone lying. Begin by positioning yourself flat on your stomach with a pillow or two under your chest, allowing your low back to gently extend. Hold this position comfortably for 5 to 10 minutes. Chest lifts. Progress by lifting your chest off the pillows for 10 repetitions, extending at the lower back while keeping your hips and elbows resting on the surface. Prone press-ups. Next, press up with your hands, allowing yourself to extend further back. Keep a slight bend in your elbows and make sure your hips remain touching the surface. Once remain touching the mat, lifting your hips or rounding your shoulders forward is incorrect. To add overpressure, exhale deeply at the top of the extension. Side shifts. If you have a left side herniation, you may extend back with your lower half shifted slightly to the left. If it's on the right, shift your hips to the right before extending. If you cannot lie down, this can also be performed standing by placing your hands on your lower back for support. Lumbar radiculopathy can also lead to secondary tightness in the hip musculature, most notably the piriformis muscle. A tight piriformis can further irritate the sciatic nerve. Seated stretch. Cross the painful leg over your opposite knee. To intensify, gently push down on the knee, hold for 30 seconds, and perform 4 repetitions. To progress, sit up straight and lean forward. Note: if your pain is strictly from an acute disc herniation, rounding your back to lean forward may aggravate it, so listen to your body. Supine stretch. Alternatively, lie on your back, cross the painful leg over the opposite knee, and pull your leg towards your chest. Hold for 30 seconds for 4 repetitions, grabbing just below your knee to deepen the stretch if comfortable. Long-term recovery requires core stabilization. An exceptional exercise for this is the bird dog. Start on all fours with your spine neutral. Keeping your core tight, raise your right arm straight out, hold for 5 seconds, and lower it back down. Repeat with the other arm, alternating up to 10 repetitions per side. Next, perform the same sequence with your legs. holding for 5 seconds while keeping your spine stable and avoiding any hip rotation. To progress further, raise your opposite arm and leg simultaneously, holding for 5 seconds. Work up to 10 repetitions on each side. Once proficient, light dumbbells or ankle weights can be added for resistance. If you are dealing with lumbar radiculopathy, take comfort in this. Most nerve root pain improves naturally over time. Current clinical guidelines recommend managing symptoms with simple over-the-counter pain relief, staying as active as tolerated, and utilizing targeted physiotherapy. Surgery is rarely needed. Fewer than 10% of patients ever require a surgical consultation. However, you must always watch for medical red flags. If you experience sudden, severe progressive leg weakness or any changes in bowel or bladder control, seek immediate emergency medical evaluation. For everyone else, consult your healthcare provider or a licensed physiotherapist to map out a safe, individualized recovery plan. If this ultimate guide helped you understand your body better, please give it a thumbs up and subscribe to the channel so we can continue bringing you free, evidence-based educational videos to keep you moving. Stay safe and see you next time.